Picture this. It's the year 2080, and doctors are helpless as superbugs resistant to every antibiotic spread through hospitals, killing patients from simple infections while medical staff scramble to keep people alive with 19th century treatments. But here's the thing. It's not actually 2080. That's happening right now. In hospitals across America today, there's a fungus called Candida auris that kills 72% of the people it infects. In 2023 alone, there were 4,514 clinical cases in the United States, and that number has tripled in just the last few years. But Candida auris is just one of several nightmare bacteria that have already infected millions of Americans. These superbugs don't respond to our strongest antibiotics. They spread rapidly through hospitals, and they're killing patients faster than we can develop new drugs to fight them. By 2050, antibiotic-resistant infections will kill 39 million people worldwide. That's not a distant threat. It's happening right now, and the post-antibiotic era has already begun. Let's start with what doctors are calling nightmare bacteria, infections that resist every antibiotic we throw at them. When bacteria become antibiotic resistant, it doesn't mean the drugs work a little less effectively. It means they don't work at all. The bacteria have evolved to completely neutralize our most powerful medicines. MRSA, one of the most well-known superbugs, now kills over 100,000 people worldwide every year. But what most people don't realize is how quickly this resistance developed. In 1975, only 2.4% of staph infections were resistant to methicillin. By 2003, that number had exploded to 59.5%. We watched a routine infection become a death sentence in real time. Even worse are the carbapenem-resistant Enterobacteria cai, or CRE. The CDC calls them nightmare bacteria because they kill up to 50% of people who get bloodstream infections. But the most terrifying emergence is Candida auris, a fungal infection that wasn't even discovered until 2009. Within 15 years, it's spread globally and become one of the most dangerous hospital-acquired infections. The CDC describes its spread as happening at an alarming rate. Unlike other infections that mainly affect immunocompromised patients, Candida auris can survive on hospital surfaces for months and spread so aggressively that entire hospital units have to be shut down. And these aren't isolated cases. The CDC tracks more than 35,000 deaths from antibiotic-resistant infections in the United States every year, with 2.8 million Americans getting infected annually. But even these numbers are conservative because many deaths from resistant infections aren't properly classified. The resistance is accelerating. What used to take decades now happens in years or even months. New resistance genes spread between bacteria like software updates, and hospitals have become breeding grounds for superbugs that we can't control. Here's how bad this crisis has already become. In 2011, the NIH Clinical Center, America's most prestigious medical research facility, lost control of a superbug outbreak. This isn't some underfunded rural hospital. It's the nation's premier medical research facility, where the world's top infectious disease experts work. In summer 2011, a patient arrived at NIH with a carbapenem-resistant Klebsiella pneumoniae infection. The hospital followed all the proper protocols: isolation rooms, protective equipment, enhanced cleaning procedures. It didn't matter. Over the next several months, 18 patients became infected with the same superbug. 11 of them died. These weren't elderly patients with multiple health problems. These were people receiving cutting-edge medical care at America's most advanced research hospital. The bacteria had developed the ability to break down carbapenems, the antibiotics doctors use when everything else has failed. But even more terrifying was how it spread. Genetic analysis showed the superbug was jumping between patients through contaminated medical equipment despite rigorous sterilization procedures. The NIH team tried everything. They tested every surface, changed every protocol, brought in the world's leading experts on hospital infection control. The bacteria kept spreading. This outbreak forced medical professionals to confront a terrifying reality. If the NIH Clinical Center couldn't stop a superbug outbreak, what hope did regular hospitals have? The answer is playing out in hospitals across the country. At Chicago's long-term acute care hospitals, researchers found that 30.4% of patients were colonized with carbapenem-resistant bacteria. Nearly 1 in 3 patients walking into these facilities already carried nightmare bacteria. When prestigious medical centers can't control these infections, the problem isn't just individual hospitals, it's systemic failure. For decades, doctors had a backup plan. When regular antibiotics failed, they could use colistin, an antibiotic so dangerous that it was banned for human use in the 1970s because of severe kidney and nerve damage, but brought back in the 2000s because it was the only thing that could kill certain superbugs. Colistin was literally the last line of defense. In 2015, scientists discovered something that changed everything, a gene called MCR1 that makes bacteria resistant to colistin. Within 1 year of its discovery, the MCR1 gene had spread to more than 30 countries. CBS News called it the discovery of bacteria resistant to last-line antibiotics. What makes MCR1 particularly terrifying is how it spreads. Unlike other resistance genes that stay locked in one type of bacteria, MCR1 can jump between different bacterial species through tiny genetic packages called plasmids. It's like a resistance gene that can copy itself to any bacteria it encounters. Scientists have now traced the gene's origin to the mid-2000s, when it developed in agricultural settings where colistin was being used routinely in farm animals. From there, it spread globally through international food trade and travel. Medical News Today captured the implications perfectly. This represents the end of the road for antibiotic treatment. When your last resort antibiotics fail, simple infections become death sentences. This crisis didn't happen by accident. It's the result of a perfect storm of failed policies and economic incentives that have been building for decades. The biggest driver is agricultural antibiotic use. 70% of all antibiotics worldwide are used in farm animals, not people. In the United States, 80% of antibiotics are sold for animal agriculture, and 70% of those are medically important drugs that humans rely on for life-threatening infections. These antibiotics aren't being used to treat sick animals. They're added to feed and water to promote growth and prevent disease in crowded, unsanitary conditions. This creates the perfect breeding ground for resistant bacteria that then spread through food, water, and direct contact with farm workers. U.S. livestock antibiotic sales grew 10% between 2017 and 2023, reaching 6.1 million kilograms annually. By 2040, global livestock antibiotic use is projected to reach 143,481 tons, a 29.5% increase. Meanwhile, the pharmaceutical industry has largely abandoned antibiotic development. The last truly original class of antibiotics was discovered in the 1980s. Today, only 43 new antibiotics are in development worldwide, and just 6 meet the WHO's criteria for innovation. 7 of the 12 companies that brought antibiotics to market in recent years have gone bankrupt. It costs $1.5 billion to develop a new antibiotic, but unlike cancer drugs or chronic disease medications, antibiotics are used for short periods and cost pennies per dose. Simply put, there's no money in saving lives from superbugs. We're in a race between bacterial evolution and drug development, and the bacteria are winning. The World Health Organization has been warning about a post-antibiotic era since 2014, a time when common infections become deadly because our drugs no longer work. That era isn't coming. It's already here. By 2050, antibiotic resistance will kill 39 million people globally. The economic cost will grow from $66 billion annually today to $159 billion by 2050. But the real cost isn't measured in dollars. It's measured in the return of diseases we thought we'd conquered. Routine surgeries become life-threatening. Cancer treatments become impossible without effective antibiotics to prevent infections. We're heading toward a medical dark age where childbirth, organ transplants, and the simple cuts could become death sentences again. The nightmare bacteria aren't coming. They're already here. They're spreading through America's hospitals. They've defeated our strongest antibiotics, and they're evolving faster than we can develop new drugs to fight them. This isn't a problem that will be solved by better hand hygiene or isolated hospital protocols. It requires fundamentally changing how we use antibiotics in agriculture, massive investment in new drug development, and global coordination to prevent the spread of resistance genes. The post-antibiotic era has begun, and we're running out of time to stop it. The next time you or someone you love needs surgery, needs cancer treatment, or gets a simple infection, the antibiotics that save lives today might not work tomorrow. What started as a miracle of modern medicine has become its greatest threat, and unless we act now, the bacteria will win. Have you ever had to take antibiotics? What would happen if they stopped working? Let me know in the comments. And if this investigation opened your eyes to a crisis that's already here, but getting little attention, subscribe for more deep dives into the systems that are failing while we're not paying attention.